Let's talk about utilization of blood flow restriction training following surgery. Many of our participants that attend our BFR seminar work in the healthcare space, more specifically in the rehabilitation space, which means they're working with a lot of patients after surgery. For example, if I had surgery on my right elbow, blood flow restriction training can be applied to this extremity. Now again, at the right time and with the right pressures and the right techniques, but this band can be applied to my right arm. I would put air into the band, my arm nice and relaxed, and I can detach the pump, and I'm ready to exercise with my right arm. Now because I had surgery on this right elbow, the doctor has laid out post-operative protocols that are recommended to make sure that healing tissue is protected. We can follow right in line with those protocols, and we can stimulate the surrounding tissue with easy, gentle movements, maybe squeezing, maybe some movements of the wrist, and I'm able to create an environment that can help the right elbow heal if that's what we're looking for in a patient following surgery. Many times though, healthcare and rehab professionals will only apply the BFR band to the surgical side. Would highly recommend looking to apply on both limbs if you're able to. And let me talk to you a little bit about why that becomes advantageous. If I'm stimulating the right side, again, we're trying to get healing tissue to recover, and that's important. But if I can apply this band onto my left arm, we'll do the same thing. Give it a little air, the arm nice and relaxed. There we go, we're ready to go on this side. What I can do with this left arm is not going to be limited by healing that's taking place following surgery. So I can execute more challenging movements on my left arm. I can cover greater ranges of motion. I can lift heavier weights. I can perform exercise with greater intensities. And that becomes very advantageous when we're looking at the healing process from a very holistic approach. When we exercise with greater vigor and greater intensity using the BFR bands, what we're able to see is a greater impact from a hormonal perspective. We're able to send signals to the brain, and the brain is able to release growth hormones and different growth factors that can be sent to different parts of the body to help facilitate the healing process in my right elbow, even though I'm vigorously exercising my left limb. So I would highly encourage you, if you're working with patients in a post-operative setting as a healthcare professional, look into applying blood flow restriction training on both limbs. Not only can we get the local effects to the limb that's healing, but by putting a band on the healthy limb, we are really able to rev up in a way the systemic effects that we can get from exercise. And that's not only beneficial to the body as a whole, but it's also very beneficial to your patient's mental recovery and their well-being, and them leaving the rehabilitation clinic feeling like they've exercised, they've stimulated their body, and they're going to feel much better in a post-operative situation. So as a review, don't just apply band on the surgical side in a post-operative case. Let's look to applying BFR to both limbs to take advantage of everything that BFR can give to your patient as they work on recovering.